for joining us today. The folks here from the WELL team and the Wolters Kluwer team are really excited to talk to you all today about how we're working together to make COVID-19 evidence-based content available to all your patients, highlighting a little bit of the overlap in terms of our products working together to support that specific use case. Just a couple of administrative items before we get started. There is a question section in the GoToWebinar control panel. Feel free to post questions there. We do have folks monitoring that during the webinar that we can surface those during Q&A at the end of the presentation. Please keep in mind that we're not answering any specific clinical questions during the webinar. I know a lot of this is focused on, a lot of us are focused on best practices related to COVID-19, but in terms of those real clinically focused questions, we won't be addressing those during the webinar itself, really focused on the workflows and value of the WELL and Wolters Kluwer integration. There is a handout also attached in your GoToWebinar control panel. That's the playbook that the WELL and Wolters Kluwer team put together to highlight in a little bit more detail the workflows that we will run through. So we'll touch on a number of topics at a high level during our conversation today, but details in terms of how you can actually deploy that using your instance of WELL in combination with content from Wolters Kluwer is highlighted in that playbook. So feel free to reference that after the webinar as well. So with that, I think I'll start with a couple of introductions. So like I said, my name is oversee business development and partnerships for WELL. I've been working closely with the Wolters Kluwer team here, especially during the time in managing COVID-19. And I'm really excited to have Jason on with me today to speak a little bit about the solution that we're bringing forward to you all. Jason, do you want to introduce yourself?
Yeah, hi. So my name is Jason Burham, and I lead the patient engagement business for Wolters Kluwer. Spent a really long time over my entire healthcare career, all focused on consumer health engagement with organizations such as WebMD, HealthWise, and now Wolters Kluwer, implementing solutions like these around really kind of key topic areas. Obviously, this is a super unprecedented time, but some of the I'd say some of the best practices, the best recipes for a successful patient engagement, even though they can be elusive, there is a way to find a good balance between the art, user design, evidence-based medicine, and behavior change science to improve the overall outcomes and experience, even, like I said, during unprecedented times. So excited to be on the line today. Thanks, Andrew. Really happy to join you and the group here, and excited to share some insights and, like I said, some best practices.
Excellent. Good lead in to our agenda for today. So really, we're going to touch on kind of three different parts during the presentation, during our talk today. First, we want to highlight what's at stake for not delivering the right information, at the right time for your patients, highlighting the problem at hand, and obviously diving into, what a patient communication tool like WELL and that best-in-class content that Wolters Kluwer brings to the table can do to help, address that problem. We also want to show you that that solution in a real-life example. We're actively deploying this COVID-19 use case that you'll see in the presentation at a number of our customers already, and so really want to highlight that, like I said, that real life use that you can bring forward to your patients, kind of based on the overview that we've given today. We'll finish up by highlighting opportunities beyond COVID-19. As Jason mentioned, obviously an unprecedented time we're working in right now, but knowing that life will slowly transition back to a little bit of normalcy here. And want folks to start thinking about, how the use cases and tools that we'll highlight during our presentation today can be applied to use cases beyond COVID-19. And then obviously we'll wrap up with Q&A. So first, just to start, I think it's useful to highlight, and this is probably common knowledge, a lot of you all are feeling this firsthand on the front lines, that the impact that COVID has had over the last month and a half, 2 months now This is actually data that WELL's pulled from our customers and the communications that we're facilitating for those customers. And as you can see, right as some of those stay-at-home orders started to be put in place and things like that, it's a huge uptick in inbound inquiries and questions coming in from patients. This is across the board, across WELL's customer base, a 285% increase in inbound messages, a total increase that we're facilitating, for our customers. It means that, in times like these, you really need to have the most efficient and effective tools in your art to be able to manage this increase effectively and to be able to give the patients, your patients, the information that they're asking for in an effective and contextually appropriate way. Next thing I wanted to highlight is a little bit of what we saw in terms of the content of the messages that patients are sending us. WELL has the ability to kind of pick up on the topic of conversation, the topic of the inquiry that patients are bringing forward to us. And these are the top 5 categories that we saw over that same time period reflected in that previous graph. And really wanted to highlight here that patients are really asking about how to manage the conditions, manage their symptoms, those clinical related communications where the value of and what comes to bear when you're talking about the ability to effectively manage that influx and that increase in total communications while also providing that effective evidence-based content that Jason will highlight a little bit later in the presentation in that interaction with the patient. So you can see clinical communications and even leading into questions about their labs or their existing prescriptions are making up over half of the 30,000 messages that represent our top 5 categories. So even just across the existing WELL customer base, you can get an idea of the type of volume of interactions that you could potentially impact as a result of bringing WELL and Wolters Kluwer together. I really wanted to highlight a little bit in terms of the types of inquiries and the way in which your staff are having to manage that influx from patients. Like I said, the categories of conversation that we're managing across our customer base and across the patients that those customers serve really is highlighting the fact that those clinical communications, those labs, questions about prescriptions are making up a vast majority of our top topics of conversation across that increase in communications that we saw here over the last 2 months or so related to COVID-19. So I think that we wanted to transition and talk a little bit about how patients are trying to address those questions, the different types of modes that patients are using, outside of interacting directly with you to self-service information, and how that may impact the outcomes that the patient would get in terms of the way that you would want them to effectively handle the questions and concerns that they do have. And I'll let Jason speak to that a little bit.
Yeah, thanks. I appreciate the opportunity to address this because, one of the things that I've really paid a lot of attention to over my term in helping with consumer health engagement is just kind of like recognizing that the status quo is broken, and you really, for many patients, and you kind of have this Goldilocks principle at play for health consumers. So you've got, the age-old method of using, mouth-to-ear technology that just doesn't work. So well documented, but 40 to 80% of what the doctor tells the patient during an encounter, it's forgotten immediately. And then to make matters worse, more than half of what the patient does recall is recalled incorrectly. So we're talking about a vanishingly small amount of actual information that makes its way from the expert, on the care team to the patient to help them with their health status and improving their health behaviors. So that approach doesn't leave the patient with enough information to make, really good personalized decisions. So back to the Goldilocks, I'd say that approach is too cold. On the other end of the spectrum, patients search for health conditions on Google and WebMD, and they kind of do this in record numbers, right? The Pew Internet Life Project, tells us annually that the numbers of health consumers searching for, the health status of themselves, as well as the people that they give care for, it, continues to climb. But, if you do a search, like I just searched Google for diabetes before I hopped on the line here today, and, came back with 630 million results. So, further, the content that, patients are looking for in those search results, it's tough to know what to trust. So I'd say that approach is too hot. There's too much information. It's hard to find exactly what works for me from a trusted source. So patients are really looking for, and really, quite frankly, we all need them to find a solution that is more just right.
Yeah, Jason, and I think that is a great point. Knowing that patients really trust you as the provider, provide that the validated information that they can rely on. I think we'll speak to our ability to correct some of these impacts of that misinformation or conflicting information, that 800 or 600 million or so results that you got in your search for diabetes. We're seeing those impacts across the board, nationally publicized when it comes to the impact of misinformation or conflicting information related to COVID-19, whether you're talking about waste of time to correct that misinformation. You're seeing search volumes, for those dangerous therapies increase by thousands of percent as the rumor mill starts to turn a little bit. You're seeing those poor outcomes and health risks actually surface themselves, in the form of negative impacts for patients, and also in terms of the way that staff have to manage not only conditions related to COVID-19, but the existing conditions that the patients are managing or trying to manage. It becomes even more complicated as you have staff trying to handle the inbound inquiries as well as the misinformation and correcting that misinformation that they're getting from the sources that Jason highlighted on the previous slide. And then, obviously this is leading to, resource overutilization, whether that be your call center handling that inbound volume, whether you're having patients present, to your ED when really they could have been, addressed in a virtual encounter or even via chat. There's a whole host of ways that misinformation or conflicting information are going to impact the way that you service your patients and the outcomes that your patients receive. So really that brings us in to start talking a little bit about the solution that WELL and Wolters Kluwer work together to develop. Really on the Wolters Kluwer side, they're bringing to bear that best-in-class, evidence-based, personalized content. I think that's really important to highlight. The fact that it's really directed to specifically what the patient is dealing with and asking about. And WELL really brings to the table the tools to get that personalized information to the patient in a contextually appropriate time and over their preferred communication mode. Whether that's getting a text with an attachment or an email with an embedded video. Really WELL's tools are allowing our customers to surface that valuable information that Wolters Kluwer provides in a way that is going to get the best adoption and get that in front of the patient in a way that they're actually going to consume it, getting back to Jason's point on the right way to communicate, with your patients. And all of that is based on, our ability to integrate. We have very lightweight ways that we can bring our two products together and deeper integrations that can get more specific in terms of the way that information is presented and surfaced. But the concept here is that each individual solution is valuable in and of itself, but as you bring the two together, you really start to see the outcomes that you want to correct some of those impacts that we highlighted on the previous slide. We can spend a couple of minutes just going into each of our individual solutions in a little bit more detail. So I'll actually hand it over to Jason to start talking about the Wolters Kluwer solution.
Yeah, and I think what's important here is just to kind of focus on the ingredients. The ingredients to the equation You know, if the equation is the right information to the right person at the right time, you know, we can kind of walk through what the best version of those ingredients are, and we can make a recommendation. And from our perspective, Wolters Kluwer, our purpose is to reduce unwanted variability in care. And I think, you know, nothing produces more variability than lots of noise. And I just refreshed my Google search result with the term COVID-19, 3.6 billion search results with a lot of sensational news articles right at the top. So the signal to noise ratio is really, really tough for patients. And, you know, what we're interested in doing as an organization is providing best in class, really rigorously evidence-based tools. And, you know, we empower physicians, nurses, pharmacists, and patients with those, you know, best-in-class tools. We do that through products that you may have heard of: UpToDate, Emmi, Lexicon, Metaspan. And these are products that are used millions of times every day to help tens of millions of patients, you know, really live healthier lives. And they're well applied in a scenario like this. And just to bring it into sharp focus around COVID-19, you know, with the arrival of COVID-19, we really threw ourselves at the work that we do best, which is creating, you know, rigorously maintained, evidence-based, up-to-date information to help our frontline workers around the world, you know, really save as many lives as possible. So, and in fact, such was the volume of searches in our tools related to the virus that we were able to overlay search term volume and geography to predict where the next possible spike in virus prevalence could occur. And we made that tool available along with all of our COVID-19 resources and some of our, quite frankly, some of our products freely available to the world to help both, you know, healthcare professionals as well as patients. And again, just to get a little specific about what makes up the right information, one of the most important aspects of the work that we do, and what we're proud of, again, is that rigor and diligence that we put into creating the content that professionals and patients use every day. Thousands of physician authors, editors, medical advisors, and of course, patient advisors are part of this really incredible machine that produces, you know, what we feel like is the most trusted clinical and patient information in the world. And beyond the evidence-based accuracy that we focus on and are so proud of, we also add a full animation production studio where our team uses the best of behavioral science, medical illustration, and content design to really captivate patients and engage them. And of course, in the context of COVID-19, we did all of that in, you know, record time to try and get these resources out into the world where they could begin helping people right away. So again, kind of going a little bit deeper, for COVID-19, we had a specific, fast, you know, comprehensive response. We developed comprehensive care instructions, multimedia-based education for frontline healthcare professionals to use when treating patients. And again, we've made those assets available for use globally at no charge. And as you'd expect, we keep these critical information resources completely up to date as the evidence changes, and it's changing frequently. And that applies to the multimedia as well. And keeping that type of content up to date is no small feat, but we're very committed to making sure that we have the right information as we look to collaborate with WELL around a solution like this.
Perfect, thanks, Jason. And that leads into the specific WELL tools, and we'll talk in generality for the WELL current users on the call. You can extrapolate this to the you know, the products you already have in place, but a few different ways that, you know, WELL feels capable and able to surface that that content that Jason highlighted on his previous slide. First off, you know, being able to proactively get in front of patients. Say, for example, outreach for scheduled encounters, whether those are those critical encounters that are presenting in person or encounters that you moved over to virtual care, to telehealth. really well has the ability to read that information, from your system of record, from your EMR, and proactively get in front of those patients with content that will help them prepare, help them feel more confident, and help address their questions and concerns in advance, say presenting for a visit. We also have the ability to pick up on what patients are asking about, so not just keeping it templated to specific procedures or specific journeys that a patient are on, but reacting to what patients are asking about. So our bots have the ability to pick up on exactly what patients are asking you about, what the context is of their question and where they're at in their journey, and automatically respond to the patient, triage conversations to user groups as potentially the concerns and questions from the patient escalate. Again, both tools really helping with that inbound influx of inquiries that everybody is having to deal with right now related to COVID-19. And then closing, the ability to target specific patient populations with specific messaging and conduct mass outreach, say as you're transitioning services, from one location to another, or from in-person to virtual, or now even back to in-person as some folks are starting to open up their services again. WELL has the ability to en masse engage and reach out to your patient population. And I think the key point here is that offers multiple different touch points, multiple different ways that WELL can surface that content from Wolters Kluwer in a way that is contextually appropriate for the patient, and will provide them with the right information at the right time to help address the questions that they have. And we do want to highlight kind of the first two of these tools in a specific use case that, like I said, we are rolling out to a number of our shared customers currently. And we'll start here with an actual conversation between a patient and their provider. You can see on the left-hand side of the screen here now, WELL is kicking off this conversation with targeted outreach that is prompting the patient to view, in this case, a COVID-19 education material from Emmy, a specific video that we'll highlight here in a minute. This is an example of that automated messaging that WELL is able to generate, based on where the patient is being seen, what they're being seen for, who they're being seen with, consuming information about that patient to refine and accurately deliver preparatory instructions, in this case, for an upcoming encounter. And then also, as you can see here, serving up the content from Wolters Kluwer in line with that communication. So not having to reroute the patient to another source, not having to point them to your website or to a different tool to specifically consume that information. Our goal is to make this as frictionless and seamless for the patient as possible by including that content from Wolters Kluwer in line with the messages that we're sending to patients to help them prepare and better understand how to address their concerns related to COVID-19. And I actually wanted to take a minute to show a little bit of that, the video itself that we reference here in this slide. I'm actually going to switch over and play that video itself. I'll probably play about 40 seconds of the video here, just so folks can get an idea of the level of detail that the Wolters Kluwer team puts into the content that they bring to bear. Let me pull that up here.
Hello, welcome to Emmy. So, what is COVID-19? Coronavirus disease 2019, also called COVID-19, is caused by a virus that can be passed from person to person. It first appeared in people in December 2019 and has quickly spread around the world. COVID-19 affects your respiratory system. In some cases, it can cause problems with your lungs, like pneumonia. There is a lot out there about COVID-19. Guidelines and recommendations are changing quickly as we learn more about the virus and how it acts. Trying to keep up with what
So I know that was just a quick snapshot of the video itself, but I think that really speaks to the level of detail and the content itself that Wolters Kluwer is providing to help educate patients as they move through and have questions related to the virus itself. I think coming back to our earlier discussion on what modes patients are using to consume information, you really want to give them the most comprehensive overview and the most detailed, timely overview in terms of how to best address their concerns and questions as possible. And the Wolters Kluwer team does a great job of bringing that forward, both in their interactive media content as well as their written content. So then continuing on in the workflow, we highlighted on that previous slide that proactive outreach to help get patients informed even before they potentially are asking you questions or starting to outreach to you. But we also wanted to highlight the ability to transition from that proactive outreach to picking up on patient-specific questions and surfacing personalized content back to them based on what they're asking you about. So in this case, our patient has asked us about their daughter, who they're bringing in for a pediatric visit in the next week. In this case, WELL's picking up on the fact that the patient has transitioned from talking about themselves and talking about their own experience to the experience of their child. And in this case, WELL's able to automatically respond. That message that you see on the bottom left-hand side of the screen is facilitated by WELL's bots. That automated response is really based on WELL's ability to pick up on that content of the inbound message from the patient. And then again, in the same way that we were inline embedding the video that we showed on the previous slide, we're delivering that customized content that's specific to a minor, to a pediatric patient, based on, again, that inbound inquiry for the patient. So just a short example of the way that WELL and Wolters Kluwer have come together to proactively get information out to the patient, address questions before the patient starts asking you, about their specific concerns related to COVID-19, and then also, our ability to follow up and triage those inbound messages from patients in an automated fashion, not just in a templated way, but giving that personalized response back to the patient without having to bring your staff into that conversation. And obviously, WELL has the ability to bring your users into that conversation to manually respond to patients, but given that influx of inbound inquiries that we highlighted at the beginning of the deck, our goal is really to take that burden off your staff while still presenting personalized content to the patient itself. So lastly, now that we've spent a lot of time speaking specifically to COVID-19, we wanted to highlight a little bit of the way that Wolters Kluwer and WELL supports the patient kind of across their continuum of care, knowing that, like I said, the use case is top of mind in terms of COVID-19 for everyone, and the solution that WELL and Wolters Kluwer developed, I think, really helps to address a lot of those negative impacts that we highlighted earlier in the deck. But this is certainly an integration that lends itself to use cases beyond COVID-19. And Jason, if you want to speak a little bit to the way that Wolters Kluwer supports the patient across their continuum of care, that'd be great.
Yeah, and then just a quick comment in the event that you didn't get a chance to hear the audio on the video sample that we played earlier, we've got a slide here at the very end that has some links to where you can go, check this stuff out more completely. And then just building on what you're sharing here, Andrew, is just to say that beyond our response to COVID-19 and the approaches that we've discussed today, Wolters Kluwer and in partnership with WELL really offer a wide range of patient engagement solutions. And one of the core tenets from our perspective is that you cannot change what you cannot measure. So to that end, everything that we do works within workflow to kind of cover the entire patient care journey across that continuum of care that we're showing you a sample of on the screen as an example, and then work to support with you measurable engagement in both inside and outside the walls of care.
Yeah, and I think that lends itself, nicely to the types of workflows that WELL helps to administer as well. Our goal is to, in the same way that Wolters Kluwer's is to sit across the entire kind of scope of interactions the patient is having, and guide the patient effectively through that process itself. So with that, I am going to jump in and just highlight quickly our contact information here for those folks, current WELL customers. If you're interested in how to deploy some of those workflows that are called out in the playbook, again, linked in the control panel for your GoToWebinar, feel free to reach out to our support team, as well as for those folks that are new to WELL. Happy to talk with you a little bit more in terms of how WELL is deployed at an organization like yours. And then obviously on the Wolters Kluwer side, as Jason mentioned, all of the content in terms of the video, the referenced attachments in the playbook, all of that is available on their website, and contact information for the Wolters Kluwer team is shared here as well. So that I'd like to close and just say thanks to everybody for attending, and we'll open things up to Q&A. Folks, feel free to start dropping questions into the chat, or to ping us here, raise your hand if you feel like you have a question you'd like us to have the group address, and we'll get you unmuted into the webinar. I did see a question about slides being available afterwards. Yes, we can. We will certainly be making the presentation available after the meeting. Any other questions from the group? Otherwise, again, I just want to say thank you to everybody for participating. Jason, in particular, thank you for being my co-host today. It was great to take the opportunity to speak to you a little bit about the work that the WELL and Wolters Kluwer team have put in, and then highlight some of the workflows that we're building, and we're excited to bring out to you all, and hopefully help to address some of the concerns and the ways that you're having to interact with your patients related to COVID-19. Thank you, Jason.
Thanks, Andrew. Likewise, really appreciate it. And thanks for everybody's time today.